Good afternoon and welcome once again to our weekly COVID-19 media briefing with Montgomery County Executive Marc Elrich, Dr. Travis Gales, our health officer, and Dr. Earl Stoddard, who is the director of the Office of Homeland Security and Emergency Management in Montgomery County. I'm Lorna Virgili, Hispanic Public Information Officer, and reporters, all of you should already have permission to record. If you do not, please use the chat box to request it, and we'll get to the portion of questions and answers right after the opening statements as usual. Mr. County Executive.
How is everybody on this fine day? It would have been nice to have a nice spring day today, but I guess this is 3:31, yet another briefing on COVID. I'll start with an update on our cases. Our cases from yesterday, today's numbers from yesterday were 115 new cases. Test positivity is 3.22%, and our cases per 100,000 are 11.95%. We continue to perform such as pretty well means in something like this compared to the rest of the state. But our numbers are increasing. In the county, we were at 9.33%, 9.33 cases per 100,000 when the governor announced his opening. We're up around 12 now. It's about a 30% increase. And our test positivity rate was in the 2s, and now it's in the 3s. So we are seeing increases in both. State numbers are more problematic. Statewide cases have risen 75%, and the positivity rate has nearly doubled in just the last 3 weeks. Those are significant changes in cases in the state. When the governor made his announcement, I commented saying that I thought this was going to lead to another spike. It has pretty much led to another spike. We have arrived, and I think it was totally predictable. It's predictable because the medical experts who work for the state had said this was not the right thing to do, and were concerned about the effects of reopening. You could predict that the more contact that people have and the more crowded spaces that one allows, the greater the likelihood that you're going to be able to spread COVID. And that's exactly the direction that we took. And I continue to be worried about it because it's not anything natural that's going to happen now that'll necessarily bend that curve back in the right direction. I'm very happy that vaccines are on the way. This is really positive news, but even in our county, we vaccinated about 30% of our people. That leaves about 70% unvaccinated, which means there's far too much room for the vaccine to spread. Obviously, some kinds of openings are, not the same as others. And I think the most problematic changes that were made were the lifting of limits on capacity, even in closed spaces, and particularly the restaurants where they were allowed to increase. Restaurants are the one place where people don't wear masks. They are the most dangerous place to open up. And despite the fact that people are told you should put your mask down, back on between bites, it doesn't happen in the real world. And so if you go into a restaurant, you see people largely unmasked for the period of time that they're eating and drinking. And that is absolutely, of all the behaviors, probably the most problematic behavior. And we've seen an uptick in cases from people who work in that industry. And I just, the question I have for the governor is, at what point do you look at the data and make a different decision? Or have we just made a decision that no matter where these numbers go, we're going to continue to stay open and hope eventually people get vaccinated and it goes away because of herd immunity? It's a high price to pay because that means more people will get sick. When more people get sick, more people will die. Those two things are pretty much inevitable consequences of this virus. It's a shame because I think, some of this is going to be, in hindsight, be avoidable, be viewed as having been avoidable, that we could have made different decisions. And and this is unnecessary. You know, our residents have endured 13 months of things that have kept us as safe as we could be. And we've come back from 3 peaks and we've turned those peaks downward. We are probably 2 months, 6 to 8 weeks away from getting a large portion of our population vaccinated. And it just seems a shame to have gone 13 months with some level of discipline and then made major decisions to open things up without the people being adequately vaccinated. So I am hoping that the governor is willing to look at the data and make what will ultimately be a short-term decision to back some things down in order to make this as safe as possible as we move to the point when there are enough vaccines in the state that we can do all of these things relatively safely. But I will tell people, in the absence of guidance from the government, that just because things are open does not mean it's safe, and it doesn't mean you should do it. And that's exactly what the governor did back in the early summer when he announced the opening of restaurants. He said, "I'm opening them, but I'm not going to go into one, into a indoor restaurant." And I would say the same thing. It may be open, but at increased capacities, we know that the risk of transmission is greater. I would eat outside. I have no problem with eating outside, but I'd be very hesitant to go into a closed space and eat right now. We need to do whatever we can do to avoid hitting a peak like we did last time. Our numbers, our cases per 100,000 are higher than they were in the second wave. We're in a position where we are worse off than we were in the summer. Our deaths per day are higher than they were during the low points during the summer. So there are a bunch of things that are indicating that this is problematic. And I do hope the governor will look at this and consider, rethinking some of his guidance, at least on some of what he opened up. This weekend, thousands of families are going to gather for Easter and for Passover. And just like at Thanksgiving and Christmas, and we will likely see an increase in cases. People are traveling, and then there's spring break. And we know that people are planning spring vacations. All of those things are considered higher risk activities. I would urge residents to really think twice about this. Unless you're vaccinated and your whole family is vaccinated, it might be wise to put off, as we ask people to do during the other holidays, to put off decisions that potentially put people at greater risk. This would hopefully will be one last time that we have to ask you to do this. But I hope people think really hard about the numbers. The numbers are sobering. And I understand that residents want this pandemic over. There is nobody that I know that doesn't want this over with. And I know people want to return to normal. I am dearly looking forward to return to normal. But I want to return to normal with as many people surviving this as we can possibly make possible. And that's been, I think our focus throughout the pandemic was to make sure that our decisions were made in order to minimize the negative health impacts that this virus had. It served the county well. It's kept our numbers lower than most. Again, lower numbers don't mean there's not been an enormous human cost in this county. Anybody who's had a friend, a loved one, a family member die knows that there's little consolation in having fewer people die than other people are having die. It is just difficult. And I hope that everybody makes decisions that allow us to minimize the difficulty and challenges that people are going to face. Like other people, I continue to be concerned about the spread of the variants. And apparently in Maryland, the British variant appears to be winning this race for the moment. And so the cases seem to be shifting in that direction. This is also why testing is so important. Our testing in the state and in the county is down substantially. And a lot of people think it's because people feel that the vaccine is coming and so I don't have to test. But testing is still really important to understand where the virus is and which virus is out there. We cannot afford to be surprised by this. It's important to know whether we're dealing with the original, whether it's the British variant, or whether it's in fact the Brazilian variant, which is more problematic than both the original and the British variant. So testing is important. We're encouraging people to get tested before holiday gatherings and get tested after holiday gatherings. We're too close to the end of this nightmare, and I don't want to see another life lost because we stopped masking up, testing, and doing the things that have worked. When I was younger and people talked about the Vietnam War, they always talked about, you know, what it must have been like to be the military leader who sent the last soldier out to die in a war that was already over. I'm feeling in this case that, you know, we know we're close to ending this. We know we're close to getting this under control. We ought to be doing everything we can do to minimize the impacts of this virus on our population. We've lost more than 100 people since my State of the County address. And that's kind of a sad note on where this has gone. On the brighter side, I'm pleased to announce that, you know, we have vaccinated more than 325,000 county residents who've received their first dose of vaccine. That's approximately 40% of our adult population. Over 76% of residents over 65 have been vaccinated, which means we've done over 3/4 of the most vulnerable population in the county. This is good news. We opened our newest vaccination site at Montgomery College's Germantown campus. I was up there this morning and it was a beautiful site. It's good to know we were able to get that running to replace the sites that we were losing. So there'll be continuity in our ability to get vaccines out. And that in a week, this is going to turn into a state mass vaccination site. And we are seeing an increased supply in vaccines. Our number that's going to county health department is up over 10,000, close to 11,000. And I believe the vaccines that'll come to the mass vaccination site will be on the order of 3,000 vaccines a week. I want to remind county residents that like all of the mass vaccination sites, they are not county sites, they are regional sites. And so though we will say we have 3,000 vaccines coming, the truth is that not all those vaccines will go to county residents. Just like county residents are going to the Eastern Shore, to Prince George's County and Baltimore to get vaccinated, people will be coming here to get vaccinated. Hopefully the number will go up. We're still waiting, I think, eagerly for further increases in the supply from Pfizer and Moderna, and for Johnson & Johnson to really kick into gear. We're still getting very low numbers of doses from Johnson & Johnson. We know those things are supposed to change. As always, I'm hesitant to put timelines on this because people were telling us at the end of February that March should be different, that all this stuff would arrive. Well, it hasn't arrived quite the way we had hoped. That's the reality of dealing with this situation. So I know it's coming. I just can't tell you the day it's going to arrive. But as more vaccines become available, we want to make sure that all residents have vaccine sites. I want to note that we've made a change in the registration, pre-registration for vaccines. As of yesterday, anybody in the county can register for vaccines. We now know, for example, that for the next 4 weeks, we'll be getting 10,000 doses a week in the county health department. So we will be able to start scheduling farther out on the horizon and scheduling larger numbers of people. This is a big change for the county. So the site originally said that if you're eligible, pre-register. If that message is stuck in your mind, you don't have to wait till you're eligible now. If you're a county resident, go on the website and register. And we will use the data you submit to put you into the category so that when you fall into a category where we begin vaccinating, you will be able to get your vaccination. We also extended our ride-on fares free until at least the end of June because we heard concern from residents, and because the federal government had supplied enough money, we weren't sure what that number was going to be when we put the budget together, but we have enough money that we can make a decision like this without having to cut some other service or something else we're doing in the county. So we're moving forward with extending the period that ride-on will remain free. And we have shuttles, and I do want to take this opportunity to thank the federal government for all the help they've been able to provide, not just the county government, but the help they've been able to provide to the businesses. This money's starting to come in. We'll be looking at money for restaurants and for small businesses. This should help provide a buffer against the damage they've had to suffer because of COVID. This is one of those cases where, businesses have been the collateral damage of this disease, just like many tenants have been the collateral damage of this and are struggling to pay rent. And I feel strongly that, the relief money coming to the federal government needs to make sure it goes to the hands of the people who have the greatest needs, whether it's small businesses in our community or whether it's individuals who have struggled with rents. We're also making progress decreasing the equity gap and who is receiving vaccines. A month ago, there was a 20% gap between white and Black Latino residents, and now it's down to a 10% gap. So we still have work to do, but we're making progress. We get out in front on equity issues early, and we've been able to amplify that work, and the results are good. So I just wanted to let people know that we're making progress on something which has been a really difficult issue, not just locally, but nationally. So as we increase the vaccine allocations, this by no means means that the pandemic is over. And this is one of the things, again, that we're worried about when people say that, we're lifting the capacity limits, and it makes things sound like they're normal. But for masks, you should be able to go about your business. And the truth is, we're not normal yet. We have lifted restrictions. There were restrictions I thought that could be lifted, but I firmly believe that, working closely with our County Board of Health, we were able to make decisions that have, minimized the impact of this virus. So I'm now going to turn this over to Dr. Gales and Dr. Stoddard, and we can go into more details about COVID cases and expansion of our vaccination sites. And look forward to your questions at the end of this.
Good afternoon, everyone, and happy Thursday. Excuse me, it's not Thursday, it's Wednesday. I'm a day ahead of myself. Always good to be here with you all. Before I go through and talk a little bit about our case numbers to supplement what the county executive has mentioned already, I would like to take a second to acknowledge that today is Transgender Day of Visibility. And in particular, that takes on added significance this year, given the continued violence that has been perpetuated against the transgender population, particularly Black transgender women, over the multiple decades, and particularly over the last several years. And also the current assaults that are being placed from a legislative perspective on transgender children. I want any resident in Montgomery County to know that as far as public health services go in this county, we are open and embracive of all of our residents, and that we are hopeful that as much as there is advocacy pushing in the opposite direction, is that on a day such as this, that all those who are allies and supportive of the transgender community are vocal and speak out in support against these types of efforts. So I just wanted to acknowledge today and acknowledge that space and acknowledge our commitment from Public Health Services to being an open environment in terms of our service delivery. So if you will permit me, I'd like to share my screen and give some insights. We shared a couple of weeks ago, I think last week, we shared the comparisons of where we were on March 8th, when the governor made the determination to open up the state and increase capacity. And I want to compare again the test positivity numbers and the case rates then to where we are today. Here's where we were effective March 8th when that decision was made. The statewide test positivity was 3.36%. None of the counties, if you see here, had test positivities above 5%. And you can see ours at 2.73.
Except Charles.
I'm sorry, except for Charles. So when we look at where we are today, The test positivity for the state has more than doubled. It's at 5.3, and there are now 14 counties that have test positivities greater than 5%. You can see ours has increased to 3.22%, again, compared to where we were several weeks ago. When we look at the case rates per 100,000, again, you can see Montgomery County at 9.3. None of the counties and jurisdictions were in the red zone, which is greater than 25 cases per 100,000. When you look at the map as of this morning, we have 4 jurisdictions who are now over 25 cases per 100,000, and a host of others that are not too far behind in terms of 19, 21, and 19.6 and 18.99. And Montgomery County has increased by about 25% from 9.33 to 11.95. So I mentioned that to say that the numbers are increasing, and in addition to the increases in community transmission levels as evidenced by test positivity, the number of cases as well as our case rate, we also have seen increases in our hospitalizations, both in terms of acute hospitalizations, as well as now we're starting to see an upward trend in intensive care hospitalizations across the state. So we're continuing to monitor these trends as well as monitor the presence of variant strains across our jurisdiction and across the state. Now, as of this morning, there were approximately over 460 cases confirmed of variant strains in the state of Maryland. We know that there have been 5 different sets of strains of the variants that have been identified in Montgomery County. And we suspect that this is what is driving the significant increase in the number of cases in the Baltimore metropolitan area and thereby ultimately across the state, particularly the strain, the B117 strain that is also known as the UK variant. But it's important to note that not all samples are being sequenced. So we suspect that the actual number of variant strains within our community is significantly higher than the 460 some odd cases that have been confirmed and reported by the state. So I want to underscore that to say that it is still important to, in addition to continuing to push and talk about vaccines, that we don't lose sight of the fact that we have an ongoing pandemic that's happening, and we need to continue to keep restrictions in place and continue to emphasize public health guidance in terms of wearing our face coverings, physical distancing as much as possible, limiting our exposure to individuals outside of our household networks, and just continuing to follow those best practices that have kept us safer throughout the pandemic. We're not through this yet. We are close to the end, I'm hopeful and promised by the number of folks that we continue to vaccinate, but we still have a ways to go. I will stop there and happy to answer any questions you all may have. Thank you.
Dr. Stoddard, do you have opening remarks?
Yeah, just a few. I want to talk a little bit about some of the work we're doing in preparing the Montgomery College site at the Germantown campus for a mass vaccination site next week. As the county executive alluded to, it did open today as a Health and Human Services sponsored county vaccination site, really helping us assess throughput and make sure that the traffic patterns are going to work as we expand into next week's statewide launch. I want to thank Montgomery College, Holy Cross Health, our partners at the state of Maryland from the National Guard and Maryland Department of Health particularly, but also recognizing all the county agencies that under the leadership of the county executive have been working cooperatively to ensure that we've got a shuttle service, we've got, we've got a security plan, we've got a traffic pattern plan, we've got doing communications to make sure people understand exactly how to operate this site. Now, one thing I want to make clear, and I reiterate something the county executive said earlier, is for people to pre-register. Both pre-register at the state level, the state mass vaccination site, as well as pre-register through Montgomery County. Because what's going to happen is the county is going to receive an apportionment of the appointment slots, and the state, including all the county residents, as well as every other county across the state, will receive a portion of the appointments. And so if you're registered in both spots, you will have the opportunity to be selected both from the county's separate pool, but also from the state pool itself. And so as of the other day, I think the state told us they had about 3,000 people on the first day pre-register in the state site with a preference for the Germantown campus site, and 2,000 people listed as their second choice. And so obviously for the first day, that's pretty good. But, you know, if we're planning to do 3,000 a day, we need people to pre-register and make sure that we have lots of names to keep pulling from to keep the site filled and vaccinating as efficiently as possible. So we definitely want to get out there that people can pre-register across all categories. I would expect that we're going to be pulling names beginning in our 16 to 64 with underlying health conditions group over the next several days as we get through our 60 to 65 pool. So please do keep pre-registering no matter what category you're in. We'll pull your name as quickly as it comes up as we move through these categories. But we want to make sure that we constantly have a group of people to be selecting from to make sure that we keep the site operating at full capacity for as long as we can. So those are the only things I wanted to mention today, and happy to take questions.
Okay, thank you, gentlemen. Let's get started with the questions. Reporter, remember to use the chat and identify the organization you work for. First one, Robert McCartney with the Washington Post has questions either for the county executive or Dr. Gales. Robert.
Thank you. I think this question is for the county executive. You said at the beginning you were very disappointed that the governor had loosened restrictions so much. Now cases are up statewide as well as here. So why are you putting it all on the governor? Why don't you ask the council, acting as the Board of Health, to reimpose restrictions for Montgomery County? At least some of the restrictions. Wouldn't that save lives? That's something within your power to do.
Well, it's my power to ask. It's no longer in my power to do, but the council said they would re-examine the data when they opened, and they've got data to look at. I know what I think of the data.
Are you then asking the council as well as the governor to reimpose restrictions?
I'm hoping the council looks at what they said and looks at the data and makes a decision based on where the data is.
When are they going to
worried about the trends?
When are they looking at the data? When's the earliest that they would do that?
I would ask Travis, when do you guys go in front of them again?
So we meet weekly with council, and in addition to the numerous briefings that we provide that are open to the public in terms of providing that guidance to discuss. So that is a process that was put into place when there was this transition based upon the governor's directive in terms of who will make those determinations on a local level. I think it's important to pivot, though. I think it's important to emphasize to your question, Robert, is that yes, there are multiple layers to ask. Right now, the restrictions in Montgomery County are still more restrictive than the state. And so what the county executive has put forward, I don't think they are exclusive from one another. I think that there does need to be consideration from the state level to consider walking back some of those provisions. As you know, the health officers were not in support and recommended to the governor not to take that step before that announcement was made. And I think another important thing to consider is in some states you have seen the governors put in metrics to determine if numbers do get to this point, we may need to walk back, because it gives communities an opportunity to understand kind of where to go and what actions might need to be taken to curb new infections and the spread of COVID. And so I think that's an important thing to also have and ask of the state, is to have some comment or opine on what types of measures would trigger potential actions if the numbers continue to worsen in the direction that they're moving right now.
Thank you.
Okay, next question comes from Dominique Bonesi from WAMU for the county executive and or Dr. Gales.
Well, McCartney took my first question. That's okay. I guess my question is now more for Dr. Gales. Can you just remind us about sort of the gathering situation when it comes to people who are vaccinated and not vaccinated? I think there are a lot of people who might say, well, at least one spouse is vaccinated, or at least, we have a few people vaccinated here. Why can't we gather together as long as we're in a small group of less than, 10 or 15 people? What would you recommend for people if they're still saying we want to get together? Of course, not everyone's vaccinated.
Well, the CDC has actually released some preliminary guidelines related to those questions. And so I would encourage folks to take a look at that. For example, the CDC has said that for individuals who have been fully vaccinated, who are at least 2 weeks outside of their last, they've completed the vaccination series, whether it's 1 shot or 2 shots as part of Pfizer or Moderna, that they may be able to interact with each other in an unmasked setting. Now, it becomes a little bit trickier when you're talking about individuals who have either not received any level of vaccination or are incompletely vaccinated, how they should go about interacting with other folks. If I recall correctly, it's put in some language to suggest that there may be some provisions for, let's say, for example, I have been fully vaccinated, but my spouse, partner, or other family members may not, that as long as we are within the same household, we may be able to interact more safely than if I were with a complete stranger. And so I think those are the kinds of things that people have to take into consideration when thinking about interacting with others and the types and quality of that interaction that takes place. Now, one of the tools that we did discuss earlier that we have to remember is that testing is an important tool piece. And so, for example, if I am thinking about, now fortunately my parents are fully vaccinated, but if I'm thinking about interacting with other folks, it's still a good idea to get tested so you know your status, to be able to think through, how safe is it to interact with other folks without, stricter parameters. So again, we would encourage folks to take a look at the CDC guidelines, but to also remember the guidelines and protocols that we've put forward and have been promoting throughout the pandemic so far to stay safe.
Thank you. Next question comes from Rebecca Tan from the Washington Post for all the officials. Rebecca.
Thank you. My first question is for County Executive Elrich. Outside of reimposing restrictions on social and commercial activity, which you said is the job of the Board of Health right now, can you tell us what you're doing to avoid the kind of spikes that we're seeing in Baltimore and elsewhere?
Well, frankly, I think that the fact that we do some things different than the rest of the state is really helpful. Our lower capacity limits have long, I think, put us in a better position. And, we've talked about this kind of almost every time we were facing a spike, that keeping the county number as low as possible when a spike began helped limit the impact of the spike, because it meant there was less presence in the community for the virus to take off of. So I think the collective actions that, we've made over the last, God knows, 10 months of actions, 11 months of actions, have been, helpful in keeping the spread down. Getting people vaccinated, the fact that we can put a shot that we get, that every dose we get, we can put in somebody's arm, is certainly going to lead to a speedier conclusion of this, because we're not stumbling over the ability to get vaccines out. So I think, it's a combination of vaccination, and it's a combination of keeping things as restrained as possible. And the other thing is, I think county residents have been really good. I remember in the beginning, people would comment about people wearing masks and they were wearing them below their noses. And that was a really common occurrence. And now when I go into places, I don't see anybody with a mask below their nose. People are wearing the masks right. They seem to be, complying with distancing and doing the things we've asked them to do. So I think in a lot of ways, credit goes to the population in this county, which has responded to some really difficult asks in a really responsible way. And I think that has made our work a little bit easier.
Add one thing to that, Rebecca.
That'd be perfect.
We also have the most aggressive testing regime of any county in the state. We are one of the few counties that has a separate contracts for testing. We're doing 5,000 or so tests a week as a county, and we've talked about this before. That's a lot lower than we're capable of doing. So we still are encouraging people to come out and get tested more, and the county is able to support nearly twice or maybe even more than that what we're capable currently doing in terms of testing. And so we offer people free, readily available testing options, and I think that's that's in support of what the county executive said about how we've been able to be more successful in keeping both our cases down, our test positivity down at the same time. And so it's not a byproduct of not testing, as it is in some other places where if you don't look for something, you're not going to find it. we're trying to look very hard for it and keeping those systems readily available, while also, everything the county executive said to try to keep the numbers down as well.
And sorry, quick follow up to that. I have a question of vaccines, but a quick follow up. What is the county doing to encourage people to keep testing?
Yeah, so we've been, obviously both through medium like we're doing right now, but also Mr. Hudson's team, the Public Information Office, has been frequently out on social media and in the media, radio and other spots talking about testing. This is a constant conversation that we have with our MHIPs, the Minority Health Initiative partnerships as well, pushing testing as a major avenue, particularly in our community, our hardest hit zip codes and in our communities of color where we know that they've been disproportionately impacted. We've been working with a lot of the frontline worker associations to try and keep reminding them that there are testing options available to them. We're working with our municipal partners, for example. They're looking for, even the city of Gaithersburg reached out to us yesterday to say, hey, can you help us get set up with recurrent testing for some of the employees that we would bring back? And so we're doing all those things concurrently. And so, yeah, we've really been trying to make testing available, readily available as well. Work with MCPS as well to both encourage testing that they have, but also offer additional options for their workers and staff and educators as well. So.
Got it. And one final question. I know that the County Department of Health allocation of doses was increased to over 10,000 doses this week. Want to make sure that that's right. And if so, can you tell us how these doses are being distributed? Where are they being administered?
Thank you for your question, Rebecca. Yes, that is accurate. Our weekly allotment was increased to 10,730, 10,530 of which are Pfizer doses, which is the first time that we have received and used Pfizer doses as part of the local health department allocation. We will continue to support the sites that we've stood up. We have pivoted from the MCPS sites to, as was referenced, we started today the site on the Germantown campus of Montgomery College. We'll be utilizing the Wheaton Rec Center as well as the White Oak Rec Center. We will also be supplying and supporting a host of community clinics who are longstanding partners with doses as well, to have stand-up clinics for their patients as well as others who meet the criteria based upon the different prioritization metrics.
Thank you.
Thank you. Next, it's Stephanie Ramirez, Fox 5 DC. Stephanie.
Hi, good afternoon, everyone. So a quick question. Well, I have a couple of questions, but I'll try to limit them. The first question I have is on the mention of how it would be helpful on the state side if they were to put some kind of metrics in place to kind of give people an idea of where we'd have to hit to go back or bring back some of the restrictions. On the county level, what are you guys looking at now in terms of what metric you want to hit to either move forward or move backward? Because the county can still make its own decisions, if not Marc Elrich, the county council.
I would be happy to answer this from a public health perspective. I think it's important to emphasize the reason why we're asking for the state to opine and comment on this is because, as we've discussed numerous times throughout the pandemic, yes, we can take individual action as Montgomery County, but in order to get the full benefit from protective measures, it really does behoove us to have a state and a regional approach to be able to guide these conversations. And it is tricky, for example, when you look at jurisdictions, because we know that everybody moves across borders, they work, they play, they do commerce and all those they shop across borders. It's important to have a regional standardized approach. So we'll continue to look at hospitalization rates, the percentage of those who have been vaccinated, as well as community transmission levels based upon test positivity, as well as our case rates.
Then a follow-up to that question, looking at the state's metrics, while percentages are going up, it looks like the death rate has kind of remained stable. Not that any death is acceptable, but it's not as increased as the other metrics. How come you're not all talking about that as much in regards to the more recent metrics?
Well, to do so from a health perspective, again, would be irresponsible and reckless. We've never focused on one particular measure to guide what we're doing. And in fact, if you look back at the epidemiologic and surveillance trends, the death number has trailed those others. It typically what's happened is we've seen an increase in cases, followed by an increase in test positivity, followed by an increase in acute hospitalizations, followed by increases in ICU hospitalizations, and then unfortunately increases in fatalities. Right now, we stand at the point where we have reached the increase in ICU hospitalizations in addition to all of those other measures. We're hopeful that we don't see an increase in COVID-related fatalities, particularly given how we are so close to being able to get access for individuals to get access to vaccines.
I want to add to that, one of the things that makes COVID different than the flu, despite what the previous president thought, is that you get over the flu, you pretty much go back to normal life. A lot of people get over COVID, life doesn't become normal. And so there are, short-term and long-term effects from COVID that continue to affect people after their body has cleared the virus. And so we focus on deaths, but there are people who are going to have impaired lives and possibly shortened lives as a result of some of the complications. And we just don't talk about that. And, I guess deaths is the metric that everybody looks at, but in real life, deaths aren't the only metric that matters to people. And so, that's kind of an invisible thing, but all you got to do is pick up the paper on any given day to read about what new side effect they've discovered and who it's affecting and what it means to people's lives, including some side effects that apparently affect mental health and senses of well-being. So there's a lot of stuff out there to indicate the problem is bigger than just, what's the death rate. And so I'm concerned about the general health impact on the community, not just the deaths in the community.
Two more questions, if I may. One is on the movie theaters and theaters not being allowed to sell food or drink. Why allow that in bowling alleys that have, prolonged periods of activity in a location plus the indoor, even though it's a larger space, but not theaters?
Anybody wants to answer that? You're mute, Dr. Gales.
I was going to say, I'm happy to answer, but others can opine as well. I think, to your point, Stephanie, we could play, devil's advocate for any of the activities that we put into place, why one is and isn't. We've tried our best to look at data that shows how certain activities are at increased risk based upon the proximity within which folks are located, as well as, the types of activities involved. We will continue to look at those measures and metrics and make tweaks to the restrictions that are put into place, based upon what we feel are the safest activities, moving forward.
And I would just add that, movie theater being dark by design, it's hard to monitor whether people are wearing masks. If you buy a box of popcorn and you're sitting there eating popcorn, it's probably in some ways worse than sitting at a table eating dinner and talking with somebody, in the sense that you're eating and your face is uncovered for a prolonged period of time. And there's nobody in there who can say, you all are, you're unmasked, you should be masked. It's really hard to monitor that, as opposed to a bowling alley where if people gather together and do things we've asked them not to do, it's easy for the proprietor to say, look, you really can't do that here, or, you need to keep your mask on. So it's just one of those more difficult places to have any control over.
The last thing I will add is one of the things that we've talked with the Board of Health about is having a natural progression in reopening, meaning for activities that have not been opened and operating to do a staged or expanding 25%, then maybe adding food at a later point, then add in 50%. Have a natural progression, because obviously many of these facilities have not been operating at all, and therefore are really putting to test their safety protocols as we speak. And so obviously going from 0 to 60 in a second, leaves very little room to adjust on the fly. And so That was one of our recommendations to the Board of Health. That is one that they have adopted. Obviously, everything that's been said already about the risks of food inside and how these and ensuring compliance of people inside these establishments is very difficult. But obviously, even just having that natural progression so that you can build upon success as opposed to, you know, allowing a bunch of activities and having a problem and not understanding or not being able to, you know, fix the problem without addressing other things too is an important part of all this.
Do we have time for one more, or should I go to the back of the pack?
Can we move forward with the other reporters and then get you back at the end, Stephanie? Is that cool? Great,
Yep.
thank you. Darío López Capera, Telemundo 44, has a couple questions.
Hi, good afternoon, everyone. I have a couple of questions. The first one is, when the Germantown vaccination site will begin to function as a mass vaccination site?
April 8th.
April 8th?
Yeah, that's the agreement we have with Maryland Department of Health. We're actually going back and forth with them. I have a meeting with them at 3 o'clock today to talk a little bit about that timeline, but April 8th is where we're operating with right now.
And this, thank you very much. And the second one is there any concern about the increase of the county's cases despite the numbers of people vaccinated? And maybe with the new variants, this could be considered as a new wave of infections?
It is a new wave of infections, and yes, we're worried. That's, you know, that's why we've been talking about not only, you know, county rates, but state rates as well. I mean, there's a lot to look at, and it's, you know, most of the news is not good news.
Is that good, Darío?
Yes,
Okay.
thank you.
Thank you. Thank you. Next is Caitlin Peets with Bethesda Bead. Questions for Dr. Gales. Caitlin?
Good afternoon. I have a couple of clarification questions from my colleague who couldn't be on the call, Dr. Gales. Previously, the state said it would reserve 10% of appointments at the mass vac site for county residents, but you're hoping for more than that. Is there any update on what to expect there, how that will work?
Well, those, as far as Dr. Stoddard mentioned, those are ongoing conversations we have with the state, but certainly we are doing our due diligence to ensure that there is a fair and appropriate share of those doses that are, you know, made available for our residents of Montgomery County. And I also just want to clarify is that by having a share of those doses specifically earmarked for Montgomery County residents doesn't mean that whatever percentage that is open to the general public, that would also be available to our residents as well as other residents across the state.
Just note, just about the mass vaccination sites. Obviously, the site at Germantown and frankly, the site in Baltimore County are very different models for what's been done across the state in terms of mass vaccination, meaning the county, Montgomery and Baltimore County bear a significant greater portion of the workload than the other state sites. Therefore, they're being largely subsidized by Baltimore and Montgomery County's taxpayers directly as well. And so we believe from an equity standpoint, just from the, you know, work in, work out perspective, our residents are bearing a greater burden in terms of their taxpayer dollars supporting the sites. They are frankly entitled to a greater portion of the vaccine doses than perhaps the standard that have been established under the other mass vaccination sites should follow.
And then maybe building off of this conversation, we're also wondering how appointments would be distributed from the appointments made between the state and county's separate registration sites. I think you maybe touched on this a little bit already, but just to make sure we're kind of all on the same page. So will those be broken out 50-50, or how will the pre-registered appointments be distributed?
So I think that's what we were alluding to, is we don't know exactly what the ratio is going to be. In our view, we'd like to see 25%, perhaps a third of the appointments on a given week allocated towards our pre-registration list, and then the remainder, 2/3 or 75%, somewhere in that range, coming from the state's pre-registration system. But obviously, that's a point that we are in the process of talking with Maryland Department of Health about. I believe the number they've quoted to us was that the other sites are about 7%, just to give you some context of the appointments. It's about 2,100 appointments per week come from host counties' portals. But again, as we said, we have a disproportionate burden in these sites, which we're happy to take on, but I think with that should come a little bit more latitude to, and as we noted before, Montgomery County residents are heavily utilizing these mass vaccination sites already. And so anything that they put into Montgomery County's pre-registration list likely frees up additional spots for other counties across the board anyway. And so to me, it's sort of, it seems fair, and it frankly probably seems to serve another purpose too of allowing for additional spots to be available to other counties in their respective regions.
Thank you.
Thank you. Next up, it's Scott Broom, WUSA 9. Scott.
Hey, everybody. Thanks for having me again today. We've already covered variants. I was going to ask about that, although if I have a second, I might ask Dr. Gales for some specifics. Listen, a lot of the reporting over the last weeks or so, we've sort of described this as a race, vaccine versus variants, or a public policy tension between expanding vaccinations and reopening. Mr. County Executive, I just wonder how you would characterize that race or that tension. Who's winning right now?
I think the virus is doing really well, but I think, the virus doesn't have a counterattack to our vaccinating people. So, our vaccinations, we're totally constrained by supply. If we had enough supply, we'd beat the virus. So the speed at which we get vaccines will determine how well we do in this race. And frankly, the more people we get vaccinated, the less opportunity there is for whatever existing virus is to spread. And I keep reminding people, this is something where the vector for transmission is another human being. This isn't like Legionnaire's disease, which lurks in ductwork, or, a virus you can pick up, from a dog or something like that. This requires a human to transmit it. So to the extent that we're able to control human interactions while we're getting people vaccinated, we have a great chance of controlling this. The problem is that when you announce, as the governor did, that like everything should open and we're going back to pretty normal, but we'll keep wearing your mask, people lose the message that you're still in danger. And this is what, I think, Travis can speak for himself, but my sense is health officials are concerned about is this creating a sense of false well-being, that the vaccine's here, we're going to be able to manage it. That's all true, but the vaccine's not here today. And so everybody still has to manage, what they do to make sure that they don't catch the virus while it's still out there. And I think, it's hard when the state takes a lead for local jurisdictions. We've experienced this painfully for the last year, that if the local jurisdiction varies from the governor, there are a ton of people think, well, you just ought to do what the governor said. They don't know that the health officials, for example, in the state don't think this is a good idea. They look to the governor as the leader on this. And if the health departments all said, we don't think this is a great idea, that's not the story. The story is the governor announced the reopening. So it creates, I think, a kind of false sense of security, and people don't have access to the equally important information from health professionals that maybe this is not quite the right time to do this. And quite is the operative word here. We are so damn close to the end of this that taking unnecessary risks is just unnecessary. It's not like we're asking people to be, like in the beginning, it's like, we don't know when this is going to end. We have no idea when this is going to end. Asking people to be patient indefinitely amidst restrictions which are not fun. Now we're at a point where we can say this is going to end. And if we all play along and do this thing really carefully, it's going to cause minimal damage. And I think, the governor kind of signaled to people that it's time to go back to normal. I don't think that was the right signal. And at the end of his announcement saying, but you should still wear masks, it kind of gets lost in, if everything else is normal, how important is that mask?
Got it. Thanks. Dr. Gales, real quickly on variants. I'm just fishing for a news hook here. Is there anything brand new on variants right now? Or I've lost track whether or not there's been a variant death reported in your county. I'm also playing off the state statistics briefed on Monday in the Senate Oversight Committee. showing that a lot of younger people seem to be pushing the trend up as the older population, I think 70% over 75 have been vaxxed. Anything in the numbers there I can sink my teeth into, variant wise?
I would say the couple take homes with the variant stories. We are not testing every sample that comes in for variants. And thereby, we do suspect that the number that is reported is actually lower than the true volume and prevalence of the variant strains out there. The second one is it appears that the B117 strain or the UK strain is increasing significantly and probably the predominant strain of all of the new cases that we're seeing across the state. Percentage, again, is hard to determine because not every sample is being tested. We have seen at least one variant strain related fatality in Montgomery County. And, you know, over the course since the variant strains were documented over a month ago. And, you know, to the point, I think another take home message is that these are easier spread strains. They are proving to be, in some cases, more virulent than the novel strain. And so while there is a skew towards younger folk getting it, because obviously we have higher percentages of older folk being vaccinated and protected against it, that doesn't mean, and I guess this gets to one of the earlier questions, that doesn't mean that young people can't get really sick and unfortunately die. And so we have to look at a host of different measures to determine the true impact, not just one particular indicator.
Thanks.
Next, Kate Ryan, WTOP. Kate?
Thank you very much. A couple of quick questions. We've talked about the restaurants being really a very serious problem. Does contact tracing show that? Or is any of the spike that we're seeing related to schools? Is there any way to pin that down? And is reluctance among community members still an issue?
Okay, I will take a stab at a couple of them, but I do want to circle back and clarify to Scott's question when I referenced and said that we are not testing all the variants. We as a local health department do not do the sequencing of samples to test whether or not they're variant strains. That is handled by the state and the Department of Health and the state public health laboratory there. So I just wanted to clarify the we and separate that so that folks don't assume that we are doing that at the local level. Now to Kate's questions, or at least the ones that I can comment on, we continue to provide contact tracing across the board in partnership with the state. We have seen one of the indicators that we follow closely is we get an employment report each week to look at and track the number of cases in certain types of employment based upon particular risk factors there. I don't have the exact number in front of me, but we have seen, one of the ones that we monitored for restaurants was the number of restaurant employees who are coming up positive or showing up in the contact tracing unit. And we have seen a slight increase in those numbers over the last several weeks as that capacity has expanded. As it relates to schools, we have, I believe we've got over 20 to 22 different instances where we are doing investigations related to cases in schools. Now, again, it's tricky with such widespread community transmission that we suspect that the overwhelming majority of those cases are coming from exposure in households or other places not in the school setting. In spite of that, we know that we have to do our due diligence to identify any other particular contacts who may have come into contact with those individuals within the school setting.
Okay. And then in terms of the efforts to get mobile vaccinations, where's the county on having teams go in these very hard to reach areas or for the frailest of our residents? What's the status on that?
So we've actually been doing that for a few weeks now. One of our community partners in particular has been instrumental in providing that resource. We also have been working with other groups who we have worked with throughout the pandemic to be able to provide those resources as well in a more focused, targeted manner. Now, that applies specifically to doing the homebound vaccination, as you referenced, in terms of going to those who are frailest or aren't able to access the sites for whatever reason. Again, it takes time because when you go do that, you've got to wait with the person for a 15 to 30-minute period of time to make sure they don't have an adverse reaction. So it takes a little bit longer to get through that list of folks within that. Separate from that, again, this is one of the things that we want to applaud our community partners and excited to continue partnering with them, is that they are able to leverage the resources they have, inclusive of their longstanding relationships with community partners, as well as their different tools. For example, their mobile units or their ability to set up pop-up vaccine clinics and opportunities at different places. So those efforts continue. We have supported a number of those events from our colleagues at the Pan-Asian Clinic, our colleagues at Care for Your Health, who've done a number of different community vaccination sites as well, in addition to the larger sites that we have ongoing on a regular basis.
Okay, and last two, I promise. I need to understand the difference between when you say hospitalizations, acute versus ICU, and at Germantown, is that 10% reserved for county residents? Is that a firm starting number?
Well, I'll take the first one related to acute versus ICU. So what I mean by acute hospitalizations is anyone who has been hospitalized for a COVID-like illness that is not in intensive care. So that could be anything from someone who is in observation versus someone who's fairly sick but not yet requiring intensive care type services. And hospitals distinguish their beds between acute and ICU type critical care services. And so that's the distinction between those two categories.
Okay, thank you. And Dr. Gales?
Yeah, the number is, it's 7% for the other sites across the state. In my conversations with the state, I want to make clear, they're not saying that's a starting point for the sites in Montgomery County or Baltimore County. They actually do agree with our position that because we are investing more county resources into these sites, that may be from a fairness perspective, okay to have a bit higher, but that is still an ongoing discussion that we are having with the state as to what that number will ultimately be. I candidly believe it is extremely likely that it is higher than 7%. But I don't know what the end point's going to be. And so that's sort of a back and forth discussion we're all having an ongoing level with the state. I think that will, once we have a resolution, we'll be happy to talk more about it.
Okay, so currently still negotiating.
Correct.
Got it. Thank you.
Thank you, Kate. And we have one last follow-up from Stephanie Ramirez, Fox 5 DC. Stephanie.
Thank you. Dr. Stoddard, can you tell us what is the price tag of that site in Germantown and estimated cost to keep it running?
I'd have to pull all those numbers together. I candidly don't have any idea. We'd have to do a lot of math on that. Obviously, we can work on doing a price tag on what that's going to cost us. I mean, to be totally clear, all of it will be FEMA reimbursable. And so obviously the cost borne ultimately by county residents after we get the FEMA reimbursements will not be that significant relative to the benefit gained by the site. But obviously we have to front all of those costs until the FEMA reimbursement comes, which can be 6 months after. And so there will be costs borne even just in terms of short-term costs. And so I can work on trying to calculate exactly what that will be. But obviously, as we're designing the site, so I don't even know totally how many, for example, traffic control personnel we're going to ultimately need when the site is at peak. We've got some modeling, but obviously that will shift over time as we learn lessons. And so we could try and develop an estimate, but I candidly do not know exactly what the cost is ultimately going to be. We've heard very much from the county executive and from the county council as well that the short-term cost is mostly irrelevant because we need the site. We need to have it up and running. It needs to be operating for our residents' benefit. And so we will calculate those costs. And obviously we're going to be responsible to our taxpayers and make sure that there won't be there won't be a Lamborghini doing transports from the parking lot to the site, for example. But we are going to make sure that the site operates correctly, it is staffed correctly, we have the right resources on site, and I can tell you what that cost will be ultimately. We'll figure it out, but we're not going to cut corners to not have things that we need on site.
Thank you. We'll have to keep out for that Lamborghini then. Keep watch. Just kidding. County Executive, I'd like to go back to the first question that was presented to you, if you don't mind. And the question had to do with why you were putting it all on the governor for reopening and the increases that we are seeing. Can you just, correct me if I'm wrong here, but prior to the governor changing, the rules so that it would be the county council now implementing changes as the Board of Health, it was my understanding that you were looking to offer some reopenings, especially with restaurants, and that the county council is going off of guidance that you had input on. Is that correct?
No, I mean, and the health officials can clarify this. The recommendation was, if you're going to do this, these are the safeguards you need to put in place. The recommendation that came over was not, you ought to do this. And that's an important distinction. I saw that press release and it's like, really? Not a press release, but the story. I mean, it is what it is at this point, but I would not have recommended going that far with this. On the other hand, why it's the governor, there are 23 counties, most of which are having serious problems. I mean, our problems are trivial compared to some of the counties. If you look at the map that Dr. Gales showed, not the map, the charts that he showed, look at some of those curves. I mean, these are publicly available. So if you don't have it here, you can certainly get it on from the state. Look at the curves for the counties. Some of them are extraordinary. There are counties that are over 35 cases per 100,000. On the 8th of March, they were all down where we were. They were a little bit higher than us, but we were all clustered between our numbers and the high 2s and other people in the mid 4s. We were all tightly clustered on some of these things. And then that clustering is kind of broken out. We were close on cases per 100,000. Now there's much bigger differences. So, and to Travis's earlier point, we may be 24 different counties. We are one state. And people go back and forth. They go to different counties, they go to different states. So what affects one person, or what can affect one county can affect other counties as well. So I'm looking at this as a statewide issue. By the way, I'm not running for governor, so I'm not doing this because I have some political ambition there. This is just looking at the raw numbers and looking at what is happening in general. I know that if this gets out of control, the more it gets out of control in other places, the more risk we are in Montgomery County. And I worry about the county's numbers because the county numbers are trending up. If they stabilize where they are, that's one thing. This, we've been at this point before. We could stabilize here. But if we are, destined to follow the same trajectory as other people are, I think that, we really need to think about how far we let this go. And I think that's the question the governor has to ask. I mean, you may be comfortable with where results are in most counties, but at what point will you be really uncomfortable with those results? And you can do the math. I mean, take the difference. What's the difference between 10 people per 100,000 and 20 people per 100,000? If I'm in a county like Montgomery County, I'm 11, almost, I'll say 1 million people. So the difference between cases per 100,000 and 10 and 20 is an additional 100 cases per day, 700 cases a week. That's not trivial. That's what people have got to think about. At what point do you just say enough is enough? We need to tighten up until the vaccines finish doing the job.
I will say, and the county executive, I've heard him talk about this, is there, and not everything's created equal in terms of risk for COVID. He's mentioned it on this call. It's a very different thing to go from 25% in indoor dining, from 25% to 50% in retail, for example. In those two different settings, you have vastly different conditions. Face covering wearing can be done constantly in a retail setting. It cannot be done constantly in a indoor dining setting. The same is true for like the duration of how long you're in there. You're more likely to be in an indoor dining setting for a longer period of time than you may be in a retail setting. there are just differences between different things. And so it's not a zero reopening or go to 100% in everything as the governor has done. It's being more thoughtful and intentional about a progressive reopening, as opposed to just taking the reins off of everything at the same time to 100% and sending the message that the pandemic is over. And that's the messaging that we do not want people to get. And frankly, we think that that has been the message that has been received throughout the state of Maryland, is that if there's no capacity limits, then the governor now believes it is safe for us to do all of these activities at nearly full bore. I understand the physical distancing, but I can tell you right now from working very closely with the enforcement teams, physical distancing is something that people do not take literally. They take it as a try and keep some distance between people, not 6 feet person, 6 feet person, 6 feet person. It is in most environments, particularly in dining. Oh no, we don't need separation of 6 feet between chairs. It's just between tables. And then you have with people 3 feet apart. It is the enforcement of these things is nearly impossible. And the messaging you send by going to 100% is that it's mission accomplished.
And there was no enforcement from the state. Even if you were going to say you could do dining at whatever capacity you can achieve 6 feet apart. And then it's like, and the counties have to enforce it. None of us have the resources to go to every restaurant and park enforcement people there every day, all day long, to make sure that there's 6 feet. And so it's a case of, so you set this regulation and then you're not going to enforce the regulation. And then if, it says, well, it's the county's responsibility to do that. That is an extraordinary lift. And there are other counties for which this is an even bigger lift than it is for Montgomery County. So, a little, I guess, to me, it's a lack of patience. We were so close. He knows how close we are. He gets these reports. He knows about, the doses. To not have just said, to reassured people that we're getting to the end of this, as opposed to open. My preference would have been caution, prolonged caution for, to get us to the point when you can say half this population is vaccinated in another couple of weeks. We'll be at 3/4. We know where we're going. More than anything, I think that's what people want to hear. That and that I can get scheduled. I mean, that's the other problem. When you tell people that you're now eligible for vaccine, but you can't get an appointment because nobody has enough appointments for everybody who's eligible. That's another thing where increasing people's expectations leads to a problem.
So at this point, are Montgomery County residents, this is the last question, are Montgomery County residents looking at more restrictions being put in place in the near future?
I'm not putting any restrictions in place. I'm asking people to look at the numbers, come up with some kind of metrics. I think, it would be helpful if the governor would do it to make it easier for everybody. If the governor and their health department would look at this and say, the data says we should probably be more cautious for a few more weeks. That would make everybody's decisions easier.
And can I just add something from the health perspective? I'm not a journalist. I'm not a media person. So I think someone made a comment earlier about the hook of the story. What we're interested in is hoping that what is not buried in all of this is why we're even having this discussion to begin with. The reason why we're having this discussion is because the numbers are concerning and the numbers are increasing across the board. And I'm hopeful that that makes it into the headline or makes it into whatever interviews happen after this, because that's the message that we need to share with folks so they understand why we are concerned and why we are taking the actions that we're taking. It's less about a back and forth with the governor. It's less about a back and forth between us and council. It's really about looking at measures that are concerning, that our residents are at increased risk right now due to the transmission levels that we're seeing.
Thank you. Thank you, everyone. And with that, we're going to wrap it up. Thank you to the county executive, Dr. Stoddard, Dr. Gales, and of course to you reporters for participating today. Stay safe, have a great afternoon, and we'll see you again soon. Thank you.
Thank you all.
Thank you.